We are looking at a set of financial markets that are brutal. We've got oil down really aggressively. Stock markets are falling. Financial markets don't like uncertainty. They don't know what they're dealing with when it comes to this new variant. Can you help us? What do we know? What do we need to know?
Well, first of all, I have to stress to everybody, viruses change. They don't stay static over the months and years. This virus, we know, is capable of undergoing mutations, and combinations of particular mutations can lead to the virus changing. There are three changes we worry about. Does it become fiercer? Does it become more easily transmitted? And does it become better at evading the protection from vaccines? The reason why we're really very concerned about this new variant is that it seems to be able potentially to do all three of those. We just don't know for sure. The uncertainty will go on for 4 weeks, but I can quite understand why financial markets are worried, because the economic recovery we've seen in recent months has been marvelous, but it has been based on an anticipation that the world will be able to keep ahead of this virus. It looks as though the virus has crept up on us a bit the last few days.
Dr. Nabarro, what does that mean if there's now variants in circulation that may be able to evade vaccines? Does that make the vaccination effort entirely futile?
It's not entirely futile, to use your words. I want to stress that in the world of vaccines, you tend to get a reduction in protection, but you don't move to a point where the vaccine becomes completely futile, as you said. So it'll be just a reduction. If it is going to happen, it'll make life more difficult, and it will mean that some re-engineering of the vaccine will be necessary. But we were anticipating this, you know. It's not as come as a complete surprise. And I think what we have to say to everybody is we've shown in the last 2 years that science is capable of putting up a good fight against this virus. And it will just be a case of going back to the drawing board and re-engineering the vaccines. It's doable. It will create a bit of a hiatus, but people absolutely should not imagine that all is lost. It's not.
Well, that's positive. Dr. Nabarro, it's likely, from what I've read this morning, that this new strain came from an immunocompromised patient, possibly an HIV patient, because the virus sticks around in their system for longer, and as a result of which has the opportunity to mutate in the way that we've seen here. What do we need to do about this? How do we stop this happening? South Africa in particular has huge numbers of HIV patients. What do we need to do as a planet, as a world, to help and make sure that this doesn't occur again?
Thank you for the way you asked that question. What do we need to do about this as a world? The answer is simple. Would leaders of every major nation stop dealing with this as though it's an issue just for their nation? It's not. It's a world issue, and it needs a world response. And the most important requirement now is to get the wonderful vaccines that we have right now more fairly distributed across the world. Why is it that there are so few people in Africa who've been able to be vaccinated, whilst there are people being offered boosters and in fact being really pushed to get boosters in Europe and in the US? It's just wrong, and it's not the right way to deal with the global threat. So I want to quote you, yes, we need a global response, and we need it immediately.
Well, Dr. Nabarro, let's talk about a certain global response today, maybe a knee-jerk reaction for countries like the UK, restricting flights from South Africa and its bordering countries. Is that an appropriate policy response, given what we know?
There's a real problem about what's happened. You know, the people in South Africa have done amazing work in the last few weeks to sequence this, and then to discover that there's a particular feature of this variant that makes it easier to detect on normal PCR testing. And they've told the rest of the world what's happening. They've been really open. And it's just really unfortunate on the other side that as soon as they tell everybody what's going on, there's a kind of knee-jerk reaction to stop flights. I'm most impressed that Dr. Fauci said today, and I understand this is quotation, that the United States needs to know more about what's happening with this virus variant before they will decide to stop flights coming from South Africa. I really want everybody to remember, you don't deal with a situation like this just by closing your borders. Very, very rarely are we able to hold back viruses through border closure. It's much better to work together and establish the best way to deal with it using the World Health Organization and connecting with the authorities of the countries concerned.
Final quick question from me, Doctor, and a question from the audience as well. We seem to be creating this impression that vaccines are the be-all and end-all, that they will protect everybody. This looks like, though, it's going to be an ongoing process, a rolling process. And I come back to the HIV patients as well. Vaccines won't work as well on them, and as a result of which we are likely to see a repetition of what has just happened. How do we deal with that again as a planet and figure out that we need to, A, deal with what is happening in South Africa and provide some protection there, and B, educate people that this is going to be a longer drawn out process? As you say, there was this expectation that we'd be done fairly soon.
Yeah, well, you are just so right on everything you say. This is a long, drawn-out issue. This pandemic is not going away anytime soon. You can't vaccinate your way out of a pandemic. That's a basic rule of life. You've got to also use measures that stop the pathogen, that's the virus in this case, from spreading. So number 3, everybody everywhere should be using well-fitting face masks at all times, especially when indoors. Everybody everywhere should maintain enough distance from others so they don't inhale the exhaled air of somebody else. Everyone everywhere needs to practice good hygiene. We need to do everything possible to avoid being in stuffy, poor air circulation places and running the risk of spreading the disease. Don't just rely on the vaccines alone. It's not enough.